Now we come to look at detailed hand massage. The hands are often the key to releasing lots of arm, shoulder, upper back and neck tension. Working this in detail can make a huge difference in your work. These techniques can be used for a wide range of conditions, and getting the detail right here will make a big difference to your massage and to your clients. When we think about how we learn anatomy and physiology, it tends to be fairly disjointed. We look at body systems in isolation, so we might look at the digestive system, the reproductive system, the adrenal system. We study them as individual systems, but of course they're connected. The body's an integrated whole, despite how many of us learnt our anatomy. It's also really only been the last 2-3 decades that within massage we've started to talk about the impact of fascia. Fascia's only been a thing within English medical literature in the last 400 years. It's too big a topic to examine here in full, but have a look at Anatomy Trends or Dr. Gil Headley's work as a good starting point for understanding more. But how does fascia affect our work? We're not just working muscles in isolation. We might have a client who comes to us and says, I've hurt my bicep and my traps are tight, and that might be the case, but that won't have occurred in isolation. My clinical experience tells me that if somebody has tightness in their shoulder, it's not just a problem with the shoulder. So my job becomes one of detective, tracking the source of the tightness that's led to the shoulder problem. That's why I teach my students we should always work inwards. If there's a problem with the shoulder, start by working the hand. If there's a problem with the knee, start by working the foot. What this does is to release tension from the extremities that allows that whole area to fully release. Sometimes you might have a client who say can't have neck work because maybe they've had a recent stroke or surgery, but their neck and their shoulders are really tight and painful. You can't massage that area, but you'll get a good level of release just from working their hands without any risk to the neck itself. Sometimes new clients are skeptical of this. Why are you working on my hands when my shoulder's the problem? I'll treat one hand and then get them to open and close both hands, and they'll feel the difference. I'll then ask them to move the affected shoulder, and they're amazed that they can already feel the difference. But when we think about how interconnected the body is, it just makes sense. We are just one interconnected being. So this handwork is critical. It'll take some time to get used to. We're used to working bigger areas, bigger muscles, and this work is very detailed. But it's worth the time and the energy investment that you put into it. You'll get quicker and longer lasting results in the whole of the upper body by doing this detailed handwork first. As we come now to demonstrate it, I'll show you that detailed handwork, and then I'll carry on up the arm to show how we'll work that area in general. For specific ailments or for conditions, we'll look at the detailed arm treatment. We'll look at those when we come to look at the conditions. Contraindications for hands. There's not too many specific things here apart from the fairly routine ones. Number one, if somebody's had recent hand surgery, then avoid it until they've been given the medical clearance to get massaged. Number two, if somebody has arthritis, don't do any knuckle clicking. If somebody has an injury, we work above and below it, but we don't work on the injured area itself. We avoid any area of broken skin that you could introduce infection into. We avoid working on the nail bed, not pressing around directly onto the nail. This will just hurt. And avoid any deep work on the fleshy area between the thumb and the first finger on a client who's pregnant. We'll discuss this more in detail in the practical work. I'm going to start by explaining what we do, and then we'll show it with our client model. There's been a tendency in massage therapy to overlook the hands as a whole, but especially the fingers because of their very small muscle contact. There's a diagram in the textbook to show the musculature of the hand. And while there's not great amounts of muscle in the fingers, remember it's that fascial work and it's the connective tissue in the fingers that's really important. That's what provides the link into the muscles of the hands and arms. If we're going to understand the body truly holistically, then we can't just give a cursory stroke to the hands and believe that they've been massaged. We need to start by warming up the hands, and then we begin our detailed work right at the end of the fingers, though we're starting to release tension held in the whole structure of the body. Otherwise, we're missing this critical starting point of where the tension's held. It's important, therefore, to start your hand massage by working the fingers in detail. Which finger you start on, it doesn't matter. Just make sure that you work them all. Initially, warm the fingers up by rolling them between your own thumb and forefinger, taking in each section of the finger in turn. Again, we'll demonstrate this in a minute with the client work. So a few golden rules. Always work upwards from the tip of the finger towards the heart. It's very uncomfortable for the client. Otherwise, if you're squeezing down the finger, it feels like your finger's going to pop. You'll see that kind of redness appear at the end. You'll find as you work that the fingers will go softer. The tension will come out of them. Don't worry if they change colour. You're increasing the circulation, which is good. But remember, as always, you're only working to your client's tolerance, to their level that they want to go to. Avoid the joints. We're not massaging directly on the joints. We're skipping over the knuckles as we work. But we can move the joints through their normal range of movement, never forcing them, just giving them a gentle workout. If the client's got any form of arthritis, be even more careful and more gentle. I'll show you soon how we work into the palm of the hand and into the back of the hand, and then I'll demonstrate how we work this kind of meaty bit at the side of the hand. We talked earlier about avoiding this meaty bit between the thumb and the first finger. This is the great eliminator point in Eastern medicine. The great eliminator will remove from the body anything that's not normally part of the body. So it's good for constipation, but obviously we need to avoid it in pregnancy. You would have to work it a lot, but there is a miscarriage risk, so that's why we avoid this point. Don't just pinch into it. It's a pressure point, so it will hurt if you pinch into it. Your aim is just to soften and relax the area around it. So work carefully, don't just grab and press. We work both hands, even if the problem is only on one side. There's more detail about the handwork in the book, so do read the accompanying textbook. This hand and arm work is critical for a number of treatments that we're going to look at. It's going to look at frozen shoulders. We'll start with a hand. Treating tennis elbow, we start with a hand. Wing scapula, we start with a hand. So I'll keep referring back in the videos to this handwork. It's really worth practicing this work on friends and family so that you can confidently do this very detailed work. So we come now to our detailed hand and arm work. This video is so important. I can't stress how important this detailed handwork is in freeing up everything around the upper body. So if you've got a shoulder problem, you need to work the hand. If there's a neck problem, you need to work the hand. Upper to mid back problem, you need to work the hand. So often in massage, hand massage has been a bit of this. Kind of like spreading a bit of lotion. It feels quite nice. It moisturizes the skin, but we're talking at a whole different level of detail here. We're going to cut in here a picture of where I've drawn some lines on Margaret's hand. These are the lines of tension that we're going to be working. So it's really important to follow them. I'll show you, but it's just useful to see them drawn on so you know exactly where I'm working. So you can see here I've just drawn the lines on Margaret's hand, and it's also in the textbook. I've just missed little bits where the skin's a bit broken from using the hand sanitizer. And these are the lines that you're working on. So it's not right on the edge, it's not right in the middle. It's kind of at that kind of 45-degree angle if you took that as the top. You can see on each hand there. So I'm working all of these lines. So you can start on any finger. I'm going to start on the little finger just because it's easier, but I could start on the thumb. I tend to work fairly ambidextrously here, so I will use both hands to work. If you think of where those lines were on the picture, I'm not coming on the top of the nail. I'm not coming right at the side of the nail. I'm working almost kind of like at 45 degrees, if you like. So I'm following down from the edge of the nail. You've got to be careful not to work on the nail bed because that will just hurt and you're not working on the tension that you want. When you're working on the top of the hand, the underneath part of the hand, obviously you can't press on both sides at once because you'll be pressing into nail. But what you're looking at doing, we're just squeezing and holding right along. If I show it on my own hand as well. So I'm pressing and releasing all the way along. It's very slow, it's very deliberate work. And it's very, very detailed. And I'm going to do each of those lines 3 or 4 times. Always working upwards towards the heart. The reason for that, if I show you on my own hand rather than on Margaret's, that's a lot kinder. If I'm working upwards, there's no problem. If I start to work downwards, you can see how red my finger's getting, and I'm kind of forcing the blood to the end. That becomes a very uncomfortable feeling. So you don't want to be kind of pinching the end of the finger. So instead, we're starting at the top and we're working down. If you think of the finger as kind of having 4 quadrants, we're working each of those areas. You can see even within that top end of the little finger, I'm working 4 different points here. Now that will depend on the size of somebody's hand. There might be 3, there might be 5. When we're working on the top of the finger, just be careful that you're avoiding the nail bed. So I'm starting much closer to the knuckle. But you can also see I'm only working as far down as the knuckle. So once we get to the knuckle, I'm stopping, and then I'm going to hop over the knuckle and I'm going to start again on the next part of the finger. Again, I'll show you on mine. So I'm coming down here. When I get to the knuckle, I'm just avoiding it and coming over. And when I'm talking about those kind of four quadrants of the finger, the first line that we're working is here, the second is here, the third is here, and the fourth is here. And what I'm doing here, I'm working on all of the connective tissue. There's not a huge amount of muscle in the hand. You know, the muscle kind of only really starts at the bottom of the finger. Sorry, there's muscle in the hand, there's not a lot of muscle in the fingers. You can see again I'm skipping over the knuckle. I tend to use, as you can see that, I'm using my thumb on this bottom line, and I'm using this part of my finger on the top. Equally, I can use 2 fingers, or you can just work them all individually. It just takes a little bit longer. I'll show you here. Now, as you can see, this isn't just a quick introductory part of the massage. This is going to take time. You can easily spend 20 minutes per hand, particularly in the beginning stages. If somebody's not had their hands worked before, you really need to be spending that time. Again, I'll show you just on mine at the top so you can see it there. When we get to this bit, my hands are a bit smaller than Margaret, so I can only get 3. And it's a press, hold, release. You'll come across a lot in this massage where we're pressing on, we're holding, and we're releasing. And we start to work on muscle, we're working on all of the connective tissue, and importantly, we're working on the fascia. And in doing that, we're starting to release the whole of the hand. When you're working with a new client with this, or if you're just introducing this into your treatments, you'll find that people say, I've got a sore shoulder, you know, my neck's really stiff. Why are you working on my hands? And so what I do then is I will work one hand in detail, and then I'll ask them to open and close both hands, and they can feel the difference then between the 2 hands. The hand that's been worked will feel obviously warmer because it's been worked, but it will also feel floppy, it'll feel soft. Some people say, oh, it feels bigger, but it's not swollen, it's not physically bigger. It just feels freer. And if you think about what our hands do in the day, you know, it's everything from picking things up. I'm just giving a little stretch of the finger there now. So I'm not aiming to crack knuckles. Sometimes knuckles will crack, but that's not my aim. What we're aiming to do here is just to release everything that the hand is holding. And you'll see some people where their fingers are like this. Their fingers, when they're relaxed, are naturally curled under. So all of this has started to shorten. So we need to get those stretched out so that the hand, when it's in a relaxed position, it will naturally curve a little bit, but it becomes more of that kind of curve rather than that kind of curve. You'll find people who will sleep with their hands in a fist particularly if they're going through a particularly stressful time. And so doing this work just stretches everything out. And if you think of how the structure of the body works and how interconnected everything is, it just makes so much sense to do this detailed handwork and to free the hands up, because if all of this is tight, then all of this is tight. You know, if that's pulling, then this isn't going to work properly. If this doesn't work properly, this doesn't work properly. If the whole arm doesn't work properly, the shoulder can't work properly, the neck can't work properly. It's just really important to free up from kind of the source of the tension. And if you think of the fascia as a big sheet of connective tissue that's going right around the body, it's quite hard to access it. You know, you can't access the fascia that's, I don't know, wrapped around organs. You can't access the fascia that's wrapped around bones, you know, that's wrapped around your spine. You can't really get into that, but you can access it here. So we're just reintroducing movement where there should naturally be movement. Sometimes we can get into this vicious cycle, and it's often called edging, but it's not actually edging, where we end up just moving a little bit less and a little bit less and a little bit less. And you see it with injuries. Somebody's, you know, hurt their shoulder, so then it hurts when they move their shoulder, so they stop moving their shoulder. And then a temporarily kind of restricted shoulder just becomes the norm. And you hear it in medical practice a lot, oh, it's wear and tear. And of course wear and tear exists, you know, vertebrae will wear, joints will wear. But so much of it is actually just down to tight muscles, tight connective tissue. And so if we can release all of that, we can get the body moving again. So what we're trying to do is get into a cycle where there's a bit more movement and a bit more movement and a bit more movement, rather than a bit less movement and a bit less movement and a bit less movement. Once we're into the thumb, you can see here the thumb is a very meaty muscle here, and particularly as massage therapists, you end up with this kind of really strong muscle here. But we're working all the way alongside. So if you can see, this is the other knuckle of the thumb. So we're working just the same as we have along here. We need to do the same along the thumb. So the first, the second and the third, it's just that the third knuckle is much lower down. But we need to do that same work. Now this is often a tender point, particularly linked to chest tightness. So again, we're looking at the people who've maybe got sedentary jobs or sedentary lifestyles, people who are hunched over a computer a lot, you know, sometimes for 40 hours a week, hunched over the computer at work, come home, get on their phones, get on their tablets, hunch over the tablet or the phone. And so what happens is the back muscles extend, the chest muscles contract, and they're in a permanent state of contraction. And you can start to release that by working right down here. So you'll hear me refer in different videos to, you must do this detailed handwork, and this is what I'm talking about. Particularly the thumb is so important. And it's just those connections then up into the front of the chest. Now for anyone who's pregnant, we're avoiding this area, the greater eliminator point. It is a pressure point, so if you just press in there, it will hurt. So you can see as I'm working down along next to the thumb, I'm working quite close to the bone. I'm using the bone as almost as something to press against. So I'm not working into this kind of squidgy bit in here, because that will just hurt. But by releasing the areas around it, you will release that area anyway. You can see I've not used any oil so far, and that's because all I would do would be to slip off. If you use oil when you've you're working on the fingers, you'll just slip off the fingers. But when I come to the back of the hand, you can use oil, or I'm just applying here a little bit of hand lotion. Just by a dint of where we are in terms of COVID, Margaret's been using a lot of hand sanitizer, and that's dried her hands out quite a lot. So I'm using moisturiser just to put some of that moisture back in. And if I did this work without moisturiser, I would start to drag the skin, and I don't want to do that. You can use oil in exactly the same way. Again, make sure you're using a good quality plant-based oil so that it's absorbed into the skin. And you can see I'm just following up in the gaps between the bones. There'll come a natural point where the bones come together and you're stopping at that point. In Margaret, that's quite low down. In myself, it's a bit higher up. I get to about here and the bones start to come together. So it's very individual to each client. We need to do some work on the palm. I wouldn't normally work with Margaret's arm kind of pulled up like this. I would normally do it down here, but you won't be able to see what I'm doing. So I'm just adjusting a little for the camera. And you can see I am pulling upwards here, but that's okay because I'm not pulling all the way to the end. And what I'm trying to do is just knead this kind of fleshy bit of the palm of the hand. You can always do this kind of sewing action using your own finger to do that. And I'm starting to just separate out in the palm. I'm not pulling to the point where it feels like the palm's going to tear. I'm sort of pushing the hand together and then pulling it through. The whole thing I'm doing is I just want to free the hand of any residual tension that's held there. Remember, residual tension is tension that's there when we're not using a muscle. So any muscle, when it's not being used, it should be fairly soft, it should be fairly pliable. Anything that's not, you've got residual tension. And you can see that we've got a kind of nice floppy hand, having done that hand work. If I was working on maybe a builder, somebody with really big hands, you can also use a massage tool. This is just a Thai massage stick. And I could use that. There'll be people whose hands are so strong or their skin is so thick because of their work, I can't get in there with my thumb. So in that instance, I'll use a stick and I'll just roll the stick. So I'll use my hand, the palm of my hand, to hold it. If you're not used to using tools, just have a practice with somebody. Nobody's going to say no to a free hand massage if you need someone to practice on. So we've got that nice, soft, pliable hand. What we should find now is that any tension in the arm and in the shoulder already starts to release. Sometimes you might not be able to work on the shoulder. They might have had, say, surgery on the shoulder. So massage is contraindicated. You can't work up here just yet. But there's pain, there's restriction there. Because they've had the surgery, you don't have surgery for no reason. So there's been some prior problem going on, possibly for months, possibly for years. That will have fed down. There'll have been repercussions in the rest of the body because of that, because we start to move differently once there's a problem. So everything gets out of alignment. If we can't work here because, say, Margaret has had surgery, but she feels all of this is really tight and her neck might be tight, we can make a positive impact on that just by working on the hand. We start to free some of those other structures up, but without interfering with the healing from the surgery. So it's such an important area. I spend so much of my career time just massaging hands. We're going to do the same with feet when we come to the foot video. So now we've worked the hand, we've added some oil up into the arm, but I'm also going to just look at what is the movement of the wrist. And I'm doing that just by moving the wrist around. Now, Margaret's wrist moves very well. You'll find that for some people, usually because of their occupation, this will be quite clunky. They'll actually move around like that. If that's the case, you need to work a little bit more into the wrist. And we do that by, as you can see, I'm supporting the hand and I'm just pressing and holding as I'm moving the wrist. I'm going in between the bones, the same at the side. and the same underneath. But just giving that rotation, if you find that it's really clunky, spend a little more time around this area. We're not working literally right into the joint, but we are working just above it and just below it. And all you're doing there is checking, is there anything that is holding the tension there that can be moved? And then we come onto the forearm. Now at the moment I'm just doing warm-up, so I can do that on both sides. Okay, as I move on to the forearm, I'm going to change position to work. This isn't my normal working position. I would often sit on the floor to do this work, or sit on a low stool. But what I want to do is I want to work the inner of the forearm before I come to work the outer. Freeing this area up first, freeing the inside of the arm first, will help free this area up. You'll find if you go straight into here and you're pressing in deep here, this is very susceptible to bruising. But if you free the arm up from this side first, you just eliminate that risk, or certainly lessen that risk. So at the moment it's just warm up. I'm just going to rest Margaret's hand on my legs. Are you okay in that position, Margaret?
Yeah, that's fine, thanks.
Thank you. I say it's a bit of an unusual position, but if I work in my usual position, I'll be in the way of the camera. So we're just adapting for the sake of the camera so you can see what I'm doing. So once I've warmed up, and you can see now I'm doing full strokes up in the direction of the muscle and upwards towards the arm, towards the heart. So as we've warmed up, you can see then I'm starting to work a little deeper. Now I can also do that up here if I need to. I can do that with the support of the table and work this way. If I'm working with somebody who's got really bulky arms, I tend to do that. And I'll support the arm on the table. Because if I'm working with someone with bulky arms, rather than using my thumb, I might use my forearm instead. Just because I don't want to damage my thumb. You know, as practitioners, we really have to look after ourselves. There's been some recent research that says the average working life of a massage practitioner is 8 years. Now that's a very short time for all the training that goes on and everything that we put into our work, and the reason people drop out of it is because they damage their own bodies. So you've got to work in such a way that you protect yourself. So always be aware as you work of your posture. Always be aware of the pressure that you're putting on your own joints. You'll see in other videos, if I'm putting a lot of pressure on here, I'll support that joint with the other thumb. And you can also do this cross-frictional work here. So the muscle is running in that direction. I've done lots of work now up in this direction, but I can also work across it. So although I'm working up and down, I'm only putting pressure on as I'm going up. You can probably see the difference there in the depth. Coming back down, I'm just kind of keeping the oil moving really. And I can also make use of static pressure. So as I follow up here, if I get to a spot that's particularly tight, I can just hold it. You can hold it for 30 seconds, you can hold it for a minute, it doesn't really matter. You hold it until you feel it soften under your thumb. And when you do, you can move on. So you can see I'm working up as far as the elbow, but I'm not working into the elbow. That becomes more important as we get further up into the body, because as you're then working, say you don't want to work into the armpit because that's a glandular area. You don't want to work the back of the knee because that's a glandular area. And it just becomes very uncomfortable and very counterproductive to work there. You don't want to damage anything as you work. We always work on the basis of first, do no harm. My other mantra is, if in doubt, don't. If you're not sure you should be doing something, then you probably shouldn't be doing it. go away, research, check what you're doing, see how your client responds to the first treatment before you go deeper on the second treatment. And you can see that's now starting to get nice and loose, so then I can come to the outside. And we're working here between the radius and the ulna. We're warming it up first of all. We've already done a little bit of initial warming up, but I'm just coming a little bit deeper. And I make a lot more use of static pressure here. It feels nicer to your client. This can be a very tight area. If it's really tight, if it's still not moving, come back to the hand. These two fingers are going to need more work in particular. You can see the link if I press really deep and flick across, you can see there Margaret's finger coming up. So that gives you a good clue as to where you need to go. Now that's just because of the connections within the hand and the arm. But if it's tight, use those connections to your advantage as part of your detective work as to where things are held. All of this is about finding where tension is held. Because although the problem might be in the shoulder, the tension isn't just in the shoulder. It's just not how the body works. Though it tends to be how a lot of, certainly 20 years ago, massage was taught. If you had a problem with the shoulder, you work the shoulder. And you could see people going over and over and over a tight spot in the shoulder. It got better for maybe an hour or two, but then somebody goes back to their normal routine, the pain came back, and it's because things hadn't been released. We do work a lot more connectively now, and a lot more connected. And then we're going to come up to the upper arm. Now before we move up to the upper arm, it's just worth noting, when you're working with your client's hand resting on your knee, just be careful where you are. So I always put a towel on my knee, so that the hand is resting here. You can also put a cushion on your knee. What you want to avoid is resting the client's hand higher up your leg so that they're now not relaxing on the table because they're thinking too much about where their hand is. And it's just that professionalism. So just being aware of your own body where you are. So we've done the hand, we've done the forearm, we're moving up above the elbow to the upper arm. And I'm going to rest Margaret's hand on the table for this and also use a little more oil. Now you need to be really careful when you're working on the upper arm because this tends to be a very tender area, particularly for ladies. So we work much more gently, at least to begin with, until we know how the client's going to respond. So you can see my initial movements are whole hand, and I'm feeling with my whole hand where the tension is. It's okay here. As I'm working a little deeper, I start to pick up tension that's coming through here. And my guess would be if I pressed hard on there, which I'm not going to do, Margaret would feel it. I'm also using a little more oil than I would normally use, just so that I'm not interrupting the demonstration to go and get more oil. I'll usually use a little bit of oil at a time. I don't like leaving my client feeling very greasy afterwards, so I'd rather add little and often than a lot all at once. But just for ease of filming, I've added a little bit more. So you can see as we're starting to warm up, and then also using my thumb. Now, the underneath part of my hand is really just supporting at the moment. I'm not putting any pressure here just yet. I will do, but just at the moment because we're just warming up. And you can see I'm warming right up to the shoulder insertion. We need to warm up both sides. And again, I'm working in a little bit of an unnatural position, just so that I'm not in the way of the camera. So you would normally come up around here as well. But I'm now doing that with my fingers instead of my thumb. Once we've warmed things up, we can start to add a little more depth. Now you can see as I'm working deeper, I work slower. So deep, fast work can be very challenging for the client, and you don't really want to be making them feel too uncomfortable. All of this is to the right depth for the client, and it will be very different for different clients. There's some clients I'll rarely get deeper than that. For others, I'll be using my forearm and I'll be really working in there. For Margaret, the balance is about right to be just using my hand. And even some of this will be a little bit challenging. I've worked with Margaret for many, many years, so I tend to know the depth that's right for her now. And Margaret is a client who would rather get in and get something sorted, and for it to be a little bit uncomfortable for a while, than just to be kind of working gently but not really getting to the heart of it. So you can see I've worked the very inner, I'm now coming back out a bit. I don't worry too much about naming the muscles that I'm working on. Particularly with clients, it can be a bit excluding sometimes. If I have a client who's a bit of a gym bunny and they like to talk about individual muscles, then I will do. But the problem with that, it gives kind of the illusion that muscle works in isolation, and that a problem with that muscle is there in isolation, and of course it's not. Muscles work in groups, and groups of muscles are affected by other groups of muscles. They're affected by connective tissue. And it's why often people will complain about a pain in one area, but actually when you get to it, the actual problem is somewhere else. It's just referring. You can see I'm working all the way up to the top. The deltoid group up here can be very tender. If something's too challenging, again, I will just use that press and hold, that static pressure. And then just release. And I'm working all the way up to the top of the shoulder here. You can keep repeating this. You can do any of these moves again and again. But what I'm starting to look for then is a real just kind of floppy arm. We can see there that beautifully floppy arm. Now that's a relaxed arm that's got no residual tension left in it, which means that any problem in the shoulder is already going to be starting to be addressed. Once we've done one side, we start to work on the other side. You can leave that arm down there if that's comfortable for the client. If they prefer, you can just tuck it in like that. It also depends on your climate. If you're working somewhere nice and warm and sunny, you might be using a sarong rather than a big thick fleece blanket, in which case they might want their arm out. But here in the UK, we're filming this in February. It's fairly cold and windy outside, so I'm trying to keep Margaret nice and toasty warm while we're working on her. So having done the one hand, I would then normally go and work the other side. I'm not going to demonstrate it twice because you can just go back and you can see the video again. But if you work one side, you need to work the other side. Even if the problem is in the left shoulder, you still work both hands, you still work both arms, because the problem in the left shoulder might be being caused by a restriction in the right shoulder. So we need to work everything together. It is extensive, it is an intensive treatment, but it's also, this is the groundwork for your whole upper body work, so you really need to get this right. If it's not something that you've normally done as part of your practice, practice on friends and family. I've done this with people sitting on a bus. You can do this hand massage anywhere. Generally, once you've massaged someone's hand once, they'll be like, oh, can you do that again? My grandchildren, who are 2 and 5, both come and just hold their hands out now, or their feet out, because they want a hand or a foot massage. It's a great treatment to do, but it's so effective.